Hello, my name is Querijn van Bokhorst. I am a research fellow at the Department of Gastroenterology and Hepatology of the Amsterdam UMC in Amsterdam, the Netherlands. And on behalf of all authors, I would like to thank Endoscopy for the invitation to discuss our recently accepted paper, Approaches to Assessing Completeness of Colorectal Polyp Resections in Clinical Practice, a systematic scoping review. Incomplete colorectal polyp resections are suspected to be the root cause for 7 to 19% of post-colonoscopy colorectal cancer cases, thereby emphasizing the clinical relevance of complete colorectal polyp resection. Meanwhile, standardized approaches for evaluation of the completeness of polyp resections are lacking. This may result in divergent quality standards between endoscopists as well as heterogeneity in used approaches to measuring the incomplete resection rate based on histopathological reference standards, which in place may hinder reliable comparisons of resection quality across resection devices and techniques, as well as endoscopists and institutions. In order to potentially allow for establishment of protocols for more standardized assessment of completeness of colorectal polyp resections, an overview of currently available methods and the way these methods are applied is needed. Accordingly, we performed a systematic scoping review in the Medline, Embase, Web of Science and Cochrane library databases, and searched for studies evaluating or validating methods aimed at either improving the accuracy of visual confirmation of a complete polyp resection, as well as methods used for histopathological confirmation of a complete resection. Meanwhile, studies relying on polyp recurrence or studies using histopathological assessment of the resection specimen margin were not considered for inclusion. Then for the results, our search resulted in over 4,600 studies, out of which 45 met the inclusion criteria. In terms of methods used to potentially improve the visual detection of residual polyp tissue after polypectomy, we identified 6 studies that evaluated the use of image enhancement techniques, 1 study that evaluated the use of artificial intelligence assisted detection, and 1 study that used the resection defect diameter to determine complete resection. Particularly, the use of image enhancement techniques was illustrated to improve the detection of residual polyp tissue in some studies. However, results were somewhat ambiguous and studies relied on the use of varying imaging modalities. Accordingly, evidence currently still remains limited. In terms of methods used to measure the incomplete resection rate based on a histopathological reference standard, we identified 29 studies that relied on biopsy sampling of the resection defect margin. And these studies showed considerable heterogeneity in terms of factors such as the location and number of biopsies taken to confirm a complete resection. Additionally, we identified 8 studies that relied on extended resection of a rim of normal appearing mucosa surrounding the resection defect after a presumed complete resection. Main difference between these studies mainly pertained to the width of the rim of normal appearing mucosa included in the extended resections. In terms of the incomplete resection rates, as measured using the divergent biopsy sampling and extended resection approaches, this figure illustrates the differences across studies. Most importantly, it highlights that incomplete resection rates regularly exceed 10%, even for subcentrometric polyps. And besides, these results suggest that for polyps within similar size categories and resected using similar resection techniques, incomplete resection rates as measured by extended resection are not consistently higher than those measured by biopsy sampling. Moreover, at first glance, incomplete resection rates do not appear to be directly related to the number of biopsies taken. However, no formal statistical testing was applied to determine the specific impact of the chosen measurement approach on the observed incomplete resection rates. Such evaluations should be considered for future research. In conclusion, this study highlights that incomplete colorectal polyp resection remains relatively common, even for smaller polyps. Moreover, evidence regarding methods to potentially improve accuracy of visual confirmation of a complete polyp resection remains limited, and there is significant heterogeneity in methods applied to measure the incomplete resection rate across studies. Findings of this review may serve as the starting point for expert consensus initiatives to establish protocols for a more standardized assessment of completeness of colorectal polyp resections. Thank you for your attention.